Dear students and my teacher friends, Namaskar. I welcome you to the presentation lecture on lungs. Now, as you can see on the screen, we can see two lungs, right lung and the left lung. The reddish purple color they are shown in, and in between these two lung, we can see there present the heart. Okay, so these are the two lungs in the thoracic cavity, and between the two lungs heart is present. Now the doctor who diagnose the disease related to the lung or the abnormalities of the lung, and the doctor, the specialist doctor who treats the disease of the lung, those doctors are known as pulmonologist. So here we are not pronouncing this as pulmonologist, but they are the doctors who are studying, who are treating the lungs. They are known as the pulmonologist. Now, the lungs means lightweight because they float in the body. Now, there is a pair of a lung in our body, and the shape, as you have seen, that the shape of the lung, they are the cone shape organ, and they are present inside the thoracic cavity. Now between these two lung heart is present, so we can say the both the lungs, left and right, they are separated by each other with the help of heart. Now the thoracic cavity in which the two lungs are present, it is anatomically having two distinct chambers, and in each chamber one lung is present. So in case of the trauma, let's say a person experiences the accident, so what happens, it is possible that one lung has collapsed, so that time the other lung, the second one, remain expanded, and the person survives with the with this one lung. Now each lung is enclosed and protected by a double layer serous membrane. So around the surface of each lung, serous membrane is present, and this serous membrane is having two layer, and both this layer, they are known as the pleural membrane. Pleural meaning side. Pleur means side, or they are also known as, this pleural membrane are also known as pleura. So in the figure, I am showing you this pleural membrane. So here you see this one and this one. These are the two membranes that we are talking about. So first, this membrane, this one. So this membrane is the visceral pleura, and this membrane covers the surface of the lung. So just above the surface, just on the surface of the lung, this visceral pleura is present. Then parietal pleura. Now, what is parietal pleura? The membrane that lines the inner surface of the chest wall. Okay, so first around the lung, visceral pleura is there, and then there is a parietal pleura towards the chest wall or towards the thoracic cavity. Now, between these two pleura, visceral and the parietal pleura, there is a space. And this space, for example, this space, they have cut off this two pleura, and this cut off part they are showing us. So, the part between these two pleura, the cavity, is known as the pleural cavity. Okay, so the here they are writing that the potential space between the parietal and visceral layers of the pleura, that is the pleural cavity, and what is they are present in this cavity. So this cavity is containing a, a thin film of pleural fluid, and this fluid lubricates the lung when when the when we are breathing. Okay, so the fluid which is present in this membranes, they act as the lubricant. Okay, and they reduces the friction between these two membranes. So here, this point we have already discussed. I have shown you both the membranes, parietal pleura and visceral pleura. Now let's read the point. Now the superficial layer is known as the parietal pleura, and this parietal pleura lines the wall of the thoracic cavity, and the deep membrane, the deep layer, which is the visceral pleura, this visceral pleura covers the lungs themselves. Okay, now the third point, we have already discussed this point. So the visceral and parietal pleura, between these two pleura there is a small space. Okay, and this small space is known as the pleural cavity. Now in this pleural cavity, small amount of lubricating fluid is present, and this lubricating fluid is secreted by these two membrane, visceral and parietal pleurae. Now, what is the function of this pleural fluid? So, this pleural fluid reduces the friction between the membrane during the breathing process. And since this fluid is present, so both this membrane, they can easily slide over one another during the breathing. So basically this fluid is acting like the lubricant, and it is reducing the friction between these two membrane during breathing. Okay, now the pleural fluid is also causes the two membrane to adhere to one another. This fluid sticks or joins the two membrane. Now in your dissection box, uh, glass slides are there, and in between these two glass slide, if you place a water drop, you will find that immediately both the glass slide, they stick together. And the reason why they are sticking together, this glass slide, is the phenomena known as the surface tension. So due to the surface tension, these two glass slide adhere or the stick to each other. The same way, since there is a this pleural fluid is present between these two membrane, so this two membranes stick together, they adhere to each other. Okay, and at the same time this fluid is also reducing the friction. Now moving on the fifth point of our discussion. Now here, first you see this figure. Okay, so here mediastinum is shown in the green color, then you see this This is the left lung, then this one is the right lung, and this part we are zooming in, so you see what is present. So this one is the this one is the parietal pleura, then membrane on the lung itself, that is the visceral pleura, and the cavity between these two pleura is the pleural cavity. Okay, so now in this point, so the separate pleural cavity, they surround the left and right lung. So here you see this cavity we are talking about, this cavity, and this cavity. Okay, so separate cavity, they surround the left and right lung, and the inflammation of pleural membrane, the situation in which the pleural membrane get the inflammation, that situation is known as the, that condition is known as the pleurisy or the pleuritis. Now in this condition of pleurisy, if it is in early stage, this problem, so this pleurisy, that is the inflammation of pleural membrane, causes the pain to the patient's body. And why this pain is occurring? So the pain is occurring due to the friction between the parietal and visceral layers of the pleura. Now if this inflammation is continuing, if it is persisting, then what happens? The excess fluid which is secreted by this two membrane, these two pleura, so this fluid accumulates in the pleural space, and this condition is known as the pleural effusion. Now, so this is the theory point, fifth, and you observe this figure. Okay. Now this figure, see what is this? Cross section through the thoracic cavity. And here this is very nice figure. All the names are given. So in this cross section, you see you can read this. The heart is shown. Then you see the position of the left lung. Okay, left lung. This one is the left lung. Then the visceral pleura. Okay, then pleural cavity, this space. Then parietal pleura is shown, aorta, right lung, ribs, sternum, breast, spinal cord. Okay, so then this way. Now histological slide they are showing, histology of the lung. A, light micrograph, and B, scanning electron micrograph. So here in the figure you see, in the figure A, alveoli are shown, bronchial cartilage, bronchial mucosa, bronchial smooth muscle, segmental, tertiary bronchus. branches of pulmonary artery. Okay, and here right hand side figure B, bronchiole and the alveoli are shown. This one is also a nice figure, and you can read all the names. Okay, so you get the idea. So where is the parietal pleura, pleural cavity, right lung, okay, visceral pleura, and here right hand side. Okay, now in this figure, this is also the cross section. Okay, the pleura and the pleural cavities. Now this part, see, they have zoomed. First you see the right lung, okay, parietal pleura, visceral pleura, then pleural cavity you see. And in this figure, okay, this side, and here you see, okay, visceral pleura, pleural cavity with serous fluid, parietal pleura, thoracic wall, lung. Okay. Now the sixth point. Now in our body, where exactly this lungs are located? So lungs extend from the diaphragm to just slightly superior to the clavicle. So we can say between the clavicle and diaphragm, these lungs are present, and they are present. They lie against the ribs. So the lungs, they are facing the ribs anteriorly and posteriorly. So this thing we are going to observe in the figure. So you see here in the figure, the color part is the lung, and with the dotted line, they are showing the ribs. So as you can see, in our rib cage, the lungs are present, or we can say the lungs are facing the ribs. So this way, and this is the posterior view. Okay, you see the position of the vertebra, okay, and the position of the ribs. Now in this figure, topography of lungs anterior view, here you see, okay, so these are the clavicle, and this part this is the, for example, this one, apex, the top portion of the lung, superior portion of the lung. This part we are talking, this part, okay, and this part. So the apex of lung is just above the clavicle. So here the clavicles are shown, and some part of the lung is crossing this clavicles. So this part, this portion which is above the clavicle, this part is known as the apex of the lung. So from clavicle to, so here the, we know now this is the abdominal cavity, and there is the presence of diaphragm. In another figure I will show you the diaphragm. So between the diaphragm and the clavicle, the lungs are present. So you observe this figure, entire figure. Now this is the lung posterior view. You see the position of clavicle, then the cervical vertebra, thoracic vertebra, and in the rib cage you see the lungs, how they are situated. Okay. Now point number 7. Now the inferior broad portion of the lung is known as the base. So here you see this one, inferior broad portion, this one, inferior broad part, is known as the base. Okay, and thus this base is the concave. So see, this is the right lung lateral view, this one is left lung lateral view, and over here in this figure this is the right lung in the medial view and left lung medial view, and here you see this base and this base. So the base is the concave part of the lung, and this concave area, this base fits over the convex area of the diaphragm. So we can say simply the base is present over the diaphragm. Now the narrow superior portion of the lung is the apex. So here you see this part, and this part. This is the narrow superior portion of the lung, and this part is known as the apex. Okay, so you observe the entire figure. Okay, this way. This way. Now the 8th point. Now this is also a very neat figure. Okay, so you see exact position of the lung, then the lobes, then the mediastinum, clavicle. Okay, everything is shown. Okay, and here see this view. Okay, mediastinal surface of the lung. So you can understand we are viewing in the direction of the black arrow. Okay, so that from that view the lung look like this. Okay, this is also figure for the lung. Okay, on right hand side all the names are given. Lobes and feathers, apex, everything is shown. Now the 8th point, in the 8th point we are discussing the costal surface. Okay, now the surface of the lung lying against the ribs, that means the surface of the lung which is facing the ribs, that surface is known as the costal surface, and this surface matches the rounded curvature of the ribs. So we know anteriorly the ribs they joined to the sternum, and then they move around the entire thoracic cavity, and on the back side they join with the vertebrae. Okay, so the curve part, when the when the ribs are curving, so in that direction the surface of the lung is known as the costal surface. Okay, So costal surface. Now here lung in situ anterior view. So here you see this figure. Okay. Try to read all the names at least once. Okay. Now in this figure you will get the idea where exactly the heart is present. So in this figure you see between the lung the heart is present. Okay. And if you are interested you can read the names of nerves and veins, aorta, artery, ribs, everything is shown. Okay. Diaphragm. So here this one is the diaphragm. Now the ninth point. Now in the ninth point we are discussing about the hilum. What is hilum? Okay. Now in the middle part or the middle surface of each lung, that is the mediastinal surface. So in the mediastinal or the middle surface of the lung, there present a region, and this region is known as the hilum. Now through this hilum, bronchi, pulmonary blood vessel, lymphatic vessel, and nerves enter or exit the lung. Okay, so in the from the from the hilum, what is happening? Bronchi, pulmonary blood vessel, lymphatic vessel, and nerves, they enter and exit the lungs. So here you see the hilum is shown. So this part, okay, this part is the hilum they are showing, and you read. So see the entire figure I'm showing you so that you can see it properly. Left lung is shown, and you see the hilum. Okay. And this one is right lung, and in the right lung also the hilum is there. Okay. Now here you observe that in the hilum what is happening. So the names you follow. See, left pulmonary artery they are showing. Okay. Then left bronchial artery, then left main bronchus, you follow the black arrows, then left superior pulmonary vein, then bronchopulmonary or HeLa lymph node, okay, left inferior pulmonary vein, okay. So this artery, veins, nerves, lymphatic vessel together they are forming the hilum, and the hilum is present in the middle part of the lung. Now, all these structures, the blood vessel, nerves, lymphatic vessel, all the structure, they are held together by the pleura and connective tissue. And together, along with the pleura, connective tissue, and all the structure, they constitute the root of the lung. So in the figure I am showing you, see in this figure, both the lungs are shown to us, okay, right and left, and you see here the root, okay, root part, and this over here this is the hilum. So in the hilum you see pulmonary artery, okay, so pulmonary artery bringing blood So the arrows are shown inside, okay, and the pulmonary vein carrying the blood from the lung outside. So the arrows are shown red in color and they are pointed outside. So figure roots and hillla of the lungs. Okay. Now, in the point number 11, we are discussing about the cardiac notch. So, in the middle of the left lung, one concave region is present, and this concavity or the concave part is known as the cardiac notch. So, here, for example, this is the left lung, and this is the concavity. This is the concave part, concave region. So this concave region is known as the cardiac notch. Now what happens to this cardiac notch? So the apex of heart fits into this cardiac notch. So in this cardiac notch the apex of heart lies. Now since the some space is occupied by the heart, the left lung is somewhat smaller than the right lung. So we can say due to the presence of heart in the left lung, the left lung is the smaller than the right lung. So here you see, you compare the size by observing the figure. Okay, this is the size of right lung and this one is the size of the left lung. So left lung looks smaller one. Then the right lung, the wall of the right lung is the thicker and broader one, and the right lung is somewhat shorter than the left lung. And the reason why the right lung is shorter than the left lung is that the diaphragm is higher on the right side, and this diaphragm accommodating the liver that lies inferior to it. So we can say, see, right lung, and beneath the right lung diaphragm is there, and then there is the presence of liver. Okay, so this is the arrangement of the organ: right lung, diaphragm, and the liver. So this is the point number 11. Now the point number 12 we are discussing. Now the lungs, they almost fill the thorax. So in the figure you see the entire thorax, the chest region you see, and the entire chest or the thorax is filled with the lungs, and the apex of lungs lies superior to the medial third of the clavicle. So these are the clavicle, and superior to this clavicle the apex of lung is present. Okay, and this apex region of the lung, this area can be palpated. And what is the meaning of palpated? So palpated means examine a part of the body by touch. So by touching this part we can experience the presence, we can feel the presence of the lungs. Okay, and the anterior, lateral, and the posterior surface of the lung lie against the ribs. So here you see, this one is the anterior surface, red in color, and it is facing the ribs. Okay, then one more figure I will show you. So in this figure, what is this? Topography of lung, posterior view, and in the posterior view you see the lungs are shown red in color, and these are the ribs. Okay, so anteriorly, posteriorly, and the side way. Okay, the lateral side. So all three side of the lung are facing the ribs. Okay, so that is the meaning of the point number 12. So this is the point number 12, and this is the figure. Now the base the base of the lung extends from sixth costal cartilage anteriorly to the spinous process of 10th thoracic vertebra posteriorly. So first we are viewing the anterior view. So basically we are focusing on the base of the lung. First of all, base of the lung we are viewing. Okay, and in anterior side where it is present? So sixth costal cartilage anteriorly. So here you see these are the ribs, 1 2 3 4 5, and this one is the sixth rib, and this one is the costal cartilage. This one is the costal cartilage, and this one is the costal cartilage of the sixth rib. And at the point of this costal cartilage you see on the back side, this is the base, and here also this is the base. So the base is present towards the costal cartilage in the anterior view, and in the posterior view what is happening? The base is facing the base is present close to the spinous process of 10th thoracic vertebra. So in the figure, okay, this is the base, of lung. This one is also the base of lung, and you see with the numbers, for example 4 5 6 7 8 9 10. So this is the spinous process of 10th thoracic vertebra, and this one is the base. Okay, so we can say the base on posterior side, the base is close to the spinous process of 10th thoracic vertebra. So this was the 12th point, okay, regarding the base, where the base is situated, where the base is present. Now point number 13. So this point also we have discussed, okay, the base. Now the final point we are discussing, point number 14. Now in this figure also you see the entire rib cage with the dotted line they are showing, and all the ribs and the sternum is shown, and you also see the position of the lung. So in the rib cage how the lungs are present. So this is the posterior, this one is the anterior view, first figure, and the second figure, in that the posterior view is shown. In the rib cage 2 lungs are shown, and in the middle 1 to 10 this thoracic vertebra they are showing. Okay, now the final point of our discussion, final point of this lecture, point number 14. Now the pleura extends about 5 centimeter below the base from the 6th costal cartilage anteriorly. Okay. So in this figure, see, okay, this is the sixth costal cartilage, and this one is the pleura. So we can say in the interior view, interior surface, what is happening? The pleura is extending few inches from the sixth costal cartilage. Okay. And on the back side, in the posterior view, what is happening? Where this pleura is extending. So 12th rib posteriorly. So this is the posterior view, and this is the 12th rib. So here you see this pleura is extended. This pleura is also extended at the level of 12th rib. Okay. And so the lungs do not completely fill the pleural cavity in this area. So we see in this area only the pleuras are present, okay, and the lungs, they are not there. So up to here the lungs are present, and here only the pleuras are present. Okay. Now sometimes what happens in this pleuras, some excessive fluid is accumulated in the pleural cavity. And how to remove this excessive fluid which is accumulated in the pleural cavity? So there is a procedure in which the needle is inserted, okay, in this pleural cavity. So the needle is inserted anteriorly through the 7th intercostal space, and this procedure of inserting a needle in the pleural cavity and removing this excessive fluid, this procedure is known as thoracentesis. Thoracentesis. Centesis means puncture. And the needle is passed along the superior border of the lower rib to avoid the damage to intercostal nerve and the blood vessel. So care has to be taken when the surgeon or the doctor is inserting the needle, so the needle is not damaging the intercostal nerve and the blood vessel. And the inferior to the 7th intercostal space, there is a danger of penetrating the diaphragm. So the care should be taken when the syringe or the needle is inserted in the patient body, that the needle is not penetrating the diaphragm. So the exact location we have seen where this extra pleura is extended, okay, anteriorly and posteriorly, and in this extended portion the needle should be inserted to a condition in which the excessive fluid is accumulated. Okay. So with this we have completed this presentation lecture on lungs. Okay, I hope you have enjoyed this presentation lecture, and I also hope that this presentation lecture will be helpful in your studies and also in your exam preparation. My name is Manish Koshti sir. I am from Ahmedabad, India. Bye bye. Namaste.